Hello, my name is Matoma Kamara. I'm going to be doing my summative head to toes assessment on my client today. I'm going to do hand hygiene, clean my stethoscope, provide privacy for my client, and do a 360 of the room. Okay. Alright. Okay. I'm going to go ahead and ask my patient her name, date of birth, where we're at, what we're doing, and looking at my patient right now. She's a small in size, and she's well groomed, smell nice, and yeah. Hi. What's her mood? Seem happy. She seem okay, regular. What's your date of birth and your name?
My name is Victoria Davies Jose. My date of birth is July 24th, 2016.
Okay. All right. Do you know where we're at and what we're doing today?
Yes, I'm at the hospital, and today we're doing a head-to-toe checkup.
Okay. All right. So my patient is aware of what we're doing today, and I'm just gonna go ahead and her body build is medium, and she's well oriented of what we're doing and where we're at. Do you know who's the president today? I'm sorry, the president and what year we're in?
Yes, Donald Trump, 2026.
All right. My patient is well aware of who the president is, where we're at, what we're doing, and yeah, pretty much. All right. I'm gonna go ahead and move on to the cardiac assessment. Do you have any shortness of breath, any chest pain, or any
No.
none? Do you have any swelling in your ankles or your feet?
No.
No? Okay. All right. That's 3 subjective questions for my cardiac assessment. I'm gonna go ahead and inspect her 5 cardiac area, which is the aortic, the pulmonic, the F point, and her tricuspid, and the mitral. All right. I'm gonna go ahead and feel for her. It's flat and good, which is normal. Which is normal also. All right, I'm gonna go ahead and feel for this. It's normal. Her pulse are normal. Alright. Everything seems normal, and I'm gonna go ahead and palpate her 5 chakras. I'm looking for any tenderness and abnormalcy. I'm gonna go ahead and listen for a long time. I don't hear any wheeziness or any abnormalcy. I'm gonna go ahead and do it the same thing for the belt. Seem normal. It's no abnormalcy in any of those. And now I'm gonna go ahead and also listen for 60 seconds for abnormalcy right here. Or for her Africa rate. Alright. It's normal. I don't hear any abnormals or anything whatsoever. Alright, now I'm gonna move on to my next checkoff, which is the vascular. Alright, for my subjective questions, excuse me, do you have any pain in your legs or your arm?
No.
Do you have any sores on your legs or your arm?
No.
Do you have any skin changes on your legs or your arm? Do you have any swollenness on your legs or your arm? All right, my patient don't have any swollenness or any whatsoever. All right. I'm gonna go ahead and turn it for 30 degrees and feel with the outer area of my hands, basically. All right. The temperature is normal. And her skin tone match her ethnicity. It's no abnormality or whatsoever. I'm gonna go ahead and feel for her pulse. Next. I went ahead and palpate one time for pulse. Alright. I went ahead and basically palpate before pulse. I'm gonna go ahead and auscultate her on both while she hold her breath. Okay. Hold your breath. Breathe in and out. This is normal. No abnormality there. Okay. Alright. I already went ahead and palpate her pulse. Now I'm gonna go ahead and I already palpate her pulse for her RDO and her Barma. Alright, now I'm gonna feel her feet with the outer part of my arm. Alright, I'm gonna feel her pulse on her legs. And okay, everything is normal. Now on the now I'm gonna go ahead and feel her catheter refill on all her fingers. Alright, everything seems normal. And her fingernails is pink and flat, which is normal. I'll also go ahead and do that on her feet. Which is normal. And I'm gonna go ahead and feel her on top of her feet for any swollenness. Just holding it for 5 seconds. Alright, okay. I already assessed her lower. That was her lower extremity. Everything is normal with her lower extremity temperature. Alright. I went ahead and did that already. I checked for her edema and everything is normal. Alright. Now, I went with everything with her edema and everything seemed normal. No abnormality there. Now I'm gonna move on to her lungs and her torsos. Alright. Do you have any shortness of breath?
No.
Do you have any shortness in breathing?
No.
Do you have any pain in breathing or coughing?
No.
Do you have any history of lung disease?
No.
All right. Patient don't have any. All right. I'm gonna have my patient sitting 90 degrees, sitting up, and I'm gonna go ahead and inspect her interior chest. Can you sit up for me, please? All right. I'm gonna go ahead and inspect her interior chest. If this was exposed, I'll be looking for her skin to see if there's any abnormality there. Just her chest, and just observe her breathing, and I'll go ahead and palpate her chest for any tenderness, any abnormality. All right. Her breathing seems normal, which is okay. And this is about 60, which is also normal, and her outer exterior is also normal. All right, I'm gonna go ahead and palpate her chest in 4 different areas, checking for any tenderness or lumps, any abnormality. Next. All right. I don't see no abnormality there. Everything seems normal. I'm also gonna go ahead and do it out of back. Can you stand up, please? All right. Can you take a deep breath for me? Can you take another deep breath? All right. Which is normal. I was just looking for a movement there. Keep standing, please. I'm gonna go ahead and oxygenate her outer exterior since she's standing up. Take a deep breath. In and out. All right, in and out. In and out. In and out. In and out. All right, you can go ahead and have a seat. All right, I'm gonna go ahead and do her inner chest area, and I'm basically just looking for the same thing: any shortness, any abnormality, or any wheeziness whatsoever. Can you breathe in and out? All right. I did not hear any abnormality whatsoever. Everything seemed normal. All right. I already did the inhaling and exhaling. Her respiratory sounds was regular, no abnormality whatsoever. All right. All right. Her respiratory rate, I measured it for 30 seconds, and I got 14, so that's normal for her respiratory rate. All right. Can you go ahead and lay down for me? I'm gonna go ahead and move on to the abdominal. I'm sorry. Can you sit up, please? I'm so sorry. All right. When was your last bowel movement? Yesterday? All right. Do you have any abdominal pain?
No.
All right. What's the next? Do you have any? Did you vomit? Do you have any vomiting or nauseousness?
No.
None. Okay. Do you have any difficulty swallowing?
No.
None. Okay. Can you go ahead and lay down, please?
Yeah.
All right. I'm gonna put that patient to a 0-degree angle. Let's see. All right. I'm gonna go ahead and observe my patient abdominal area for midline, color, or anything whatsoever. I'm gonna go ahead and palpate her abdominal. I will go ahead and listen for her bowel sounds before I palpate it. All right, now I'll go ahead and palpate her bowel movement. Her abdominal area 4 times in each quarter, or in a circular movement. All right, I didn't feel any tenderness. Everything seemed normal, and her skin tone is pretty normal. I did not see any discoloration or anything. I didn't feel no masses whatsoever in her abdominal area. Everything is normal. All right, that was my head to toe assessment. Yeah, thank you.